Live, sir. Start.
Good evening. Good evening,
Okay,
everyone. Welcome to the third day of the webinar from Keynotes Homoeopathy. And today with us we have Dr. Himangsu Hait, sir. He is MD, PhD, and Professor and HOD in Department of Practice of Medicine in Calcutta Homeopathic Medical College and Hospital. Sir have a very vast experience in teaching practice of medicine. Today, sir will be discussing about lifestyle diseases and their management and how can we keep fit with homeopathy. So, welcome, sir, to the stream.
okay. Thank you, Dr. Rohit, and the total team of Dr. Rohit. Now I am starting the very important topic nowadays, that is lifestyle diseases and keeping fit with homeopathy. Now we have first know what is lifestyle disorders. Lifestyle disorders are defined as the disorders developed in people due to their way of living. So way of living mean which type of food we are consuming, which type of drinks we are taking, which type of medicines are usually we taking left and right, the smoking and other unhealthy food components, improper physical activity, and stressful life. So stressful life nowadays, we are just running for improving our total life status, our economic status, and that some different types of hazards are we are facing day to day in our life. The unhealthy food components from very beginning of the day, when we are taking the tea with some biscuits or snacks after breakfast, lunch, whatever may be, these are containing the very bad quality of oil, mostly mostly the palm oil. All we are taking fast foods basically made by palm oil. And just in next part of my lecture, I will discuss that such component though are containing in this low quality oil, those are making different types of food components which are very much available in our market. We are taking, and ultimately we are consuming very bad qualities of cholesterol, very bad quality of trans fat, and these are helping for the unhealthy scenarios of our blood vessels in different sectors of our body. I will discuss in detail about the improper dietetic schedule. We are consuming very much amount of trans fat, very low density lipid, and they are disproportionately increase the lipid components, and ultimately they are promoting the intimal layers of the blood vessels. They are anoxic state, and ultimately the formation of atheroma. I will discuss in detail in my next step. Another one is physical improper physical activity, lack of activity, sedentary life, which usually we are habituated in in our life. Basically, the large number of people, they are they are not performing the basic physical activity, but intake excess calorie day to day, and intake alcohol, smoking, whatever may be. All these are the causes of these lifestyle disorders. In fact, lifestyle disorders includes the mostly the total vascular unhealthy scenario, and basically forming by these atheroma, and atheroma followed by improper supply of blood to the systemic areas. And these systemic areas, when they are facing that ischemic scenario of the systemic tissues, ultimately these ischemic scenarios of the tissue, they are forming the in fact improper stability of the tissue, and they are making the ulceration and ischemic damage. And this ischemic damage in different systemic areas, such as within the heart, such as within the kidney, it may be in the brain, it may be in the different muscles. Their ultimate forming prolonged ischemic scenario and followed by the specific damage of tissue. Ultimate, we are facing different systemic disorders related to the lifestyle changes, lifestyle hazards. Another causes of lifestyle, another abnormalities, those we are facing by improper lifestyle schedule, basically the hypertension, stroke syndrome, obesity disorder, and the different heart diseases. And this hypertension, I will discuss in detail. The stroke syndrome, their pathological changes, their symptomological presentation, their complications in case of heart disease, particularly in ischemic heart disease, in heart failure, different conductive disorders within the heart, whatever may be. Basic, all these are the ultimate scenario of improper lifestyle. Those come from obesity. Those are developed from obesity. Basically, the total energy requirement per day in our life, in case of lifestyle modification, we are consuming excess than the requirement, and ultimately this excess energy supply, excess intake of calorie, they are converting the different types of abnormal component in our body. They are increasing the dyslipidemic state. They are ultimate inviting the disproportionate triglyceride level. Ultimate, those are creating different types of lifestyle hazards. Now, other some scenarios are developing from lifestyle disorders are diabetes mellitus. We know that our pancreas and its tail containing islets of Langerhans and beta cell. These beta cells can liberating insulin. So these insulin exactly helping to utilize glucose, which we are consuming through our food, and ultimately their oxidation only occurred within the cell and within the mitochondria. These insulin can only helps to entry of this glucose molecule into the cell, and ultimately after entering these glucose molecules into the cell, the mitochondria can perform the Krebs cycle, and ultimate heat will be released after breakdown of this glucose. So, as per lifestyle modification, as per lifestyle hazards, we are intaking excess amount of carbohydrate calorie, excess amount of fat and other components, in fact calories, particularly in carbohydrate, the diabetes mellitus, improper secretions of insulin, or damage of the beta cell of pancreas, their these insulin are not able to support to entry the glucose into the cell and ultimately within the mitochondria. As a result of it, the excess glucose are increasing within the plasma, and a time will come when the glucose level increasing, which cross the threshold level and will passes through the urine. Other component, other some disorders, other very common problems, those we are facing from lifestyle disorders like cancer, like COPD, like cirrhosis of the liver, which I will discuss in later. Now, the lifestyle disorders that is dangerous to our civilization and particular will be treated as to threat to the civilization, because these lifestyle disorders now started hitting kids as well. That means these lifestyle disorders, now we are observing several cases in our clinic, that not only the elderly person, not also the old aged person, but adolescents are also suffering some lifestyle disorders. you also know that there are several cases of heart failure, there are several cases of stroke we are facing in our clinic. There are several numbers of in fact childhood stroke syndrome in the tertiary health setup. But all these scenarios are usually occurring due to the imperfect lifestyle maintained. Basically, why these kids are usually suffering this type of lifestyle disorders? Exactly, the purchasing power now shifting. Basically, these all purchasing power which are shifting due to the coming in technology and the ability to capacity, basically the total economic status of the society and total global scenario. As per lifestyle disorders, about 14.2 million people between the age group of 30 to 69 years, they are prematurely died every year by lifestyle diseases. And not only that, we have become invited to some extremely uncommon diseases our grandparents had never heard about the back in 60s or 70s decade. Now, lifestyle disorders, which I said just few minutes ago, that we are habituated to intake of junk foods. So junk foods mean the different types of fast foods. Those are basically made by very low quality oil, very low quality other food components. They are coloring food, different coloring agents, sometimes foods containing different types of preservatives. Ultimately, these junk foods can promote for formation junk food can promote for formation of different systemic abnormality, mainly by dyslipidemia, and increase the trans fat within the blood. So I would like to share about the different chain, different bondings of different types of foods, particularly the saturated fatty acid. These saturated fatty acid made by carbon molecules along with different arms and with hydrogen, then totally saturated, so no double or triple bonds are present in between C carbon component. So these are the saturated fatty acid. Next, second point, that is unsaturated fatty acid. These unsaturated fatty acid in between carbon component, their presence either double or triple bond along with the different arms attached with hydrogen molecules. But other some third type, some extra type of fat component, those are not under saturated, those are not under unsaturated. Their basic internal structural component slight different. These are trans fat, and these trans fat basically helping to the formation of atheroma within the blood vessels after intimal entry of these trans fat, because they are permeability to the intimal layers of the blood vessels, and after entry within the blood vessels between subintimal layer they are forming foam shell, and after formation of this foam shell the blood vessels and its intimal layer becoming ischemic damage and formation of fibrous tissue. And this fibrous tissue when formed within the intimal layer of different systemic blood vessels, they are form atheroma along with component of the fat globules. And these trans fat basically which we are taking through the different fast foods or sophisticated foods, ultimate we are helping to formation of atheroma. And these atheroma which will localized within the coronary arteries and will form the coronary heart disease. Sometimes this atheroma which will be formed within the internal carotid artery, sometimes division of the internal carotid artery, sometimes the particular area of the middle cerebral artery, and sometime it will be deposited within the Charcot artery, the branch of middle cerebral artery, and that particular middle cerebral artery, those are supplying blood vessels to the very vital areas of our brain, that is internal capsule. And ultimately, the formation of this atheroma, when present within the common carotid artery, either in the middle cerebral artery or in the Charcot artery, the ultimatum is improper supply followed by ischemic damage of the brain tissue. The ischemic damage of the brain tissue within the internal capsule can presenting with stroke syndrome, which I will discuss very detail in it in my next step of the lecture. Now I'm coming to the very important another point. Those are related to the lifestyle disorders and abnormal food component which are suffering that large number of peoples in our country in a total civilization. Basically this, the triglyceride comes to a threat, that abnormal triglycerides, there's a, there this is attacking to our life and to our health as the as the very important crucial point. They can create very crucial point to the different systemic disease, and this is the triglyceride chemical bonding, and these triglyceride increase ultimate can create sudden vasoconstriction, sudden systemic ischemic damage, sudden stroke syndrome, sudden myocardial infarction. Basically, the sudden abnormal clinical scenario usually can invite by increment of triglyceride, which is a main component of the as a whole lifestyle modification, lifestyle abnormality in our life. Now, I'm coming to the next step. These atherosclerosis, about 90% of the total atherosclerosis, basically the history of very important systemic diseases like high blood pressure, like diabetes mellitus, high cholesterol or dyslipidemia, and along with triglyceride abnormality, the obese abnormality, and this is very important point that these atherosclerotic changes, those are the creating by abnormal lifestyle modification, by after intake of very abnormal or low quality of oil or different types of food consumption. Ultimately this atherosclerosis can create different important disease like hypertension, diabetes mellitus, dyslipidemia, obesity, cancer. And this is a very important point. These atheromatous changes from which are developing from abnormal lifestyle modifications, basically gradually entering to our genetic sector. These total genetic codon, those are made by the double helix, this DNA that is the total double helix and internal formation. The basically these codons of genes regular hitting by abnormal exposures like from food, from different types of medicines, from different types of ray exposures, different chemicals, after from pesticides, whatever may be. The total internal, the configuration of genetic structure, that is adenine, guanine, cytosine, thymine, those are creating the double helix structure of the DNA. Very minutely they are changing, and which call the mutation, and these point mutation ultimately can create different types of diseases including hypertension and diabetes mellitus. And these hypertension, diabetes mellitus, and so different types of metabolic abnormality, Those are basically the main pathological changes within the systemic diseases are made by these genetic mutating state, and these genomic mutation ultimately can carry from generation to generation, and ultimate when we are facing, when we are in maintaining this abnormal lifestyle in this generation, by next generation which carrying to the further generation, and ultimately this property will entering into the genetic codon and will carry from generation to generation, and ultimately the total disease are maintained by genetic configuration, even those are maintaining in my lifestyle in present scenario. Now, this is the cardiovascular atherosclerotic changes. Now I am coming to the in detail the systemic changes, systemic pathological scenario. Those are creating by the abnormal total life schedule, which I just said in few minutes back, and this is the atheroma. And this atheroma, when formed within the arterial intimal sector by any system, suppose these atheroma which are forming, which are they are starting within the coronary artery. We know that our heart basically supplied by two coronary artery initially, the right and left, and ultimately right and left coronary artery, the further branching and supplying to the heart by anterior descending coronary artery, posterior descending coronary artery, right marginal coronary artery, and left marginal. And all these four branches from right and left coronary artery, they are forming multiple twigs and supplying to the each and every area of the heart. Particularly the both ventricles, those are very vital, those are very active part of the heart, which are maintaining the total pumping or create pumping force, which can create pressure for ejection of the blood to the system, and also during diastole those are intake blood from the system and also the pulmonary circuit, again for purification or the supplying to the next bit. These ventricles basically supplied by both right and left coronary artery and their branches and twigs, which I said in my legs in my last slide, that these atheroma, when deposited within this coronary artery, these atheroma which are deposited in the coronary artery, and ultimately they are narrowing of these coronary arteries, and ultimate narrowing of the coronary lumen will not supply the proper blood to the very active areas of the heart, mean cardiac ventricular wall. These ventricular wall, when suffering from ischemic scenario, initially they are presenting slight discomfort in precordium, slight pain, or which is radiating manner to the both arms, shoulder, sometime in the chin, sometime in the precordial sector, and these precordial discomfort gradually turning to its critical point with severe cramping and crushing pain of the precordium. And this is due to the total blockage of the coronary artery and made by formation of this atheroma within the coronary artery. It may develop associated with the sudden spasm of the coronary artery, and ultimately will form the myocardial infarction. This is the myocardial infarct area, and the slide is indicating that coronary artery which become narrowed by formation of this atheroma and deposition of this atheroma within the intimal sector. And this coronary angiogram, this slide is showing the coronary angiogram, and two particular black arrows are showing the narrowed part of the coronary supply, and particular these narrowed area are not able to supply the blood to the distal sector, and particularly the ventricular wall are not getting sufficient amount of oxygenated blood arterial blood for which cannot create sufficient contractile force for rejection of the blood to the system. Ultimate patient initially suffering from ischemic heart disease, very acutely presenting with myocardial infarction, and finally established the heart failure due to myocardial infarction. The very dangerous clinical presentation due to the lifestyle changes. As a as a good doctor, as a good doctor, we must have to diagnose such type of cases as early as possible. Few patients sometimes may report you that doctor, just now I am suffering from simple acidity because just today in lunch I took just very spicy food, oily food, so I think I am suffering from acidity. But as a good doctor, you never think that the case when come to you above 50 years or around 50 years or elderly age group, when he can provoke you that, sir, I am suffering from simple acidity. But as a good doctor, you first think the case, it may be a ischemic heart, it may be a case of myocardial infarction. Because if you think the case as simple acidity, the case must will die by myocardial infarction. But if you think the case as ischemic heart or myocardial infarction, simply you have to check the blood pressure every 5 minutes interval, and this is very important, and very classically you will observe that blood pressure is getting down gradually. This is the first indicator that patient is now suffering from myocardial infarction. As a good doctor, you have to advise that thus you have to check your blood for just cardiac enzyme assessment. Suppose CP can be sometimes troponin T, and these cardiac markers, it may be high, sometimes double, sometimes triple, 4 times, 50 times more than that normal, and a patient will survive. Otherwise, simply as a if you not detect the case as myocardial infarction or coronary heart disease, the patient will die. This is the this is the turning point of our treatment, that is diagnosis of the disease. If you simply or casually just deny the total disease knowledge to your observation, if you not properly utilize your knowledge in this case, the patient will die. So you have to sincere about our clinical examination, about our diagnosis of the disease. Otherwise we will not shine in our practice. Now I'm coming to the another very important disease, that hypertension. We know that the hypertension is basically the persistent rise of the blood pressure at or above the level of 140 or 140 by 90 millimeter of mercury. Okay, all right. But we have to know there's most of the cases, those are secondarily appear to us. Even those are normal hypertension, basically primary type. eh? These all are due to the premature increment of the peripheral resistance by formation of atheroma within arterial supply, or it tweaks, and due to increased peripheral resistance by narrowing of the arterial lumen, the peripheral resistance will be high, and ultimate the perpendicular pressure of the blood flow become higher, and this is presenting as hypertension. So from very beginning we have to know that hypertension, it also create from the formation of atheroma within the blood vessels, which is very much related to our daily life and also lifestyle and also consumption of food component. Those are ready food, those are packet food, those are spicy or oily food. All these are cause of this hypertension. We have to know the next step of the disease, that is I will discuss in later. No, now I'm coming to the next point. We know that hypertension may present in different cases, sometime with headache, sometime it may be with amblyopia, sometime with nocturia. Few patients may also come with irritability, whatever may be. But if we do not diagnose the case in very earlier stage, patient will come to us with one or more of the complication of hypertension. There are so many complications of hypertension. There are so many systemic complications of hypertension. Few patients may come to us the complications of retina, complications of eye problem, and retinal complications are very much important in case of hypertensive cases, presenting with grade 1, grade 2, grade 3, grade 4, and in advanced retinopathy. If we just go through the disease text medicine, that grade 1, basically the straightening of the blood vessels, the thickening of the wall, narrowing of the lumen. In case of grade 2, grade 1 plus the arteriovascular nipping of the retinal sector. In case of grade 3, the presentation is grade 2 plus exudation in between retinal blood vessels. Sometimes it may be soft exudate or it may be hard exudate. Exactly, these are not at all exudates, but these are the infracted head of optic nerves present within the retinal field. And these infracted areas are developed due to the continuous hypertensive state and ischemic zone of the retina, which are developed by increment of the peripheral pressure of the arterial twigs, are due to depositions of atheroma. Not only that, in case of atheromatous changes, these very minute capillaries become form the sometime minute, sometime major, the aneurysm, sometime very aneurysm, sometime microaneurysm, and these aneurysm when become ruptured within this retinal field, the hematoma may develop in retinal layers, and ultimate forming hematoma followed by dissecting aneurysm within the retina. Patient finally come to us with complete blindness. In case of cardiac complications from hypertension, the cardiomegaly, the abnormal cardiac activities, ejection fraction abnormality. So we have to diagnose the case from very beginning. When a patient come to us with simple headache or simple findings from hypertension, we have to identify by the knowledge of practice of medicine, by the knowledge of disease. Otherwise, we will we will fail to proper treatment. Ultimately, will come to us with complications. So this will not the target of a good doctor. A good doctor must have to target to identify the case, to total receive the total symptom sign of the patient, and advise the proper similima medicine by which a patient can cure the disease. So I will discuss in my last part of this lecture. So how we can get the exact diagnosis, and this diagnosis will help how to select a similima. Now I'm coming to the next part. These atheroma which are forming within the coronary artery, and this common carotid artery in common carotid bifurc area, and by deposition of this atheroma within the common carotid artery or their arterial bifurc area, and ultimate form narrowing of the arterial lumen. Sometime this narrowing when reach to the 50%, sometime more than that, the total blood supply to the brain is decreasing, and ultimately the gradual decreasing supply of blood to the brain, our brain tissue crying for more and more blood. When this brain tissue, cerebral tissue, are not receiving sufficient amount of oxygenated blood or other food components of the blood. Initial presentation, it may be by headache, by change of moods, behavior, improper concentration, sometimes sleeplessness, etc. But as a good doctor, we must have to identify these clinical presentations from very beginning of this cerebral ischemia. Otherwise, the fatal scenario will come as complication of the disease, and particularly from lifestyle changes. These complications and ultimately these ischemic changes, when due to the depositions or narrowing of this common carotid artery, sometimes middle cerebral artery, sometimes any part of the circle of wheels, or any branch which are supplying to the internal capsule or in basal ganglia, because we know that internal capsule is a very vital area of the brain where major pyramidal fibers are descending and they are supplying the motor sensation to the whole opposite half of the body. Similarly, the basal ganglia, those are supplying, those are helping to transmit the extrapyramidal fibers to the similarly opposite part of the body, and these pyramidal and extrapyramidal, those are maintaining voluntary and involuntary impulse respectively from center to peripheral parts of the body. That mean the total motor activities are controlling by this pyramidal and extrapyramidal. Voluntary and involuntary motor activities are not properly distributing due to the ischemic damage either within the internal capsule or in basal ganglia. So, from very beginning, very minute symptoms, as a good physician, we must have to identify from disease pathological process. We must have to apply the disease of knowledge of disease, knowledge of pathology, knowledge of physiological supply, physiological areas, for detection of the symptoms which is going in our body, which is moving in our brain, which pathology is continuing in our particular brain area. Otherwise, by sudden rupture of aneurysm within the internal capsule, the intracranial hemorrhage is the ultimatum, and the hematoma, when developed within the internal capsule or it may be in the basal ganglia, ultimate patient will come to us with hemiplegia, sometime paraplegia, sometime quadriplegia, monoplegia, whatever, what may be. So, as a good physician, we have to know the total disease pathological process, and the symptoms of the patient are indicating you all these pathological changes. We have to eye for observation. Otherwise, we will not detect the internal pathology. Now, I'm coming to the next part. Another part of lifestyle. The slide is showing that very rarely a person is taking alcohol. So, alcohol, it may be teachers, it may be doctors, it may be judges, it may be professors. All sectors are present within the bottle. Oh, I know that. So, alcohol intake, what what pathology is going, what pathology is developing by improper or excessive alcohol intake. Very interesting. Alcohol basically change with our liver as aldehyde, and this is the cycle by which alcohol can transfer to aldehyde. Very interesting. This slide is total indicating that pathological scenarios, the total circuit, the cycle which is moving within our liver. And very much important, we have to know this: these aldehyde ultimate will damage the hepatic tissue. Then this sprout-like arrangement and hexagonal structure of the lobules of the liver, and ultimately which are arranged in central vein and alternately as spoke of a wheel, that sinusoid vein, liver tissue, sinusoid, biliary canaliculi, hepatic tissue, and this sproke-like arrangement of the liver, and they are damaged, their function disrupted, their architecture become disrupted, and ultimately a patient will come to us with fatty liver, and this is the initial step of hepatic abnormality. This is the hepatic fatty liver is the initial step which may occur from very commonly from alcohol intake. Sometimes few patients may also come without any alcohol intake, without any history of alcohol intake, may also come to fatty liver. And we have to know that without alcohol intake, the same pathological scenario are going within the liver and basically forming aldehyde and damage of the total structure of the hepatic tissue, and ultimate will come the grade 1, grade 2, grade 3 fatty liver, and finally the liver ultimately reach to some cirrhotic changes as a result by pathologically the total hepatic tissue, they're forming multiple micronodules, sometimes macronodules, sometimes fibrous tissue, calcified areas, and total hepatic architecture become damaged, including hepatic function. And these final cirrhotic changes is the optimal point of the total hepatic disruption of the function, basically developed by lifestyle changes, lifestyle disease. Now I'm coming to the another slide, the alcoholic fatty liver, and gradually fibrotic changes, and ultimately the chronic hepatitis or cirrhotic changes ultimately will come to us with hepatic failure. Now this is another series. Suppose from normal liver come to the chronic hepatitis followed by cirrhotic changes, and ultimately patient will come to us as the hepatic carcinoma. Now I'm coming to the next step, obesity and sedentary habits. These obesity and sedentary habits basically calculated by BMI. We know the total our weight in kg by height in meter square. So height in meter square, weight in kg by height in meter square, and that this is the BMI, and BMI must in normal condition total must be more than 25, and in case of must be less than 25. So BMI when become abnormal, basically can control our the total cholesterol level, basically which form the total dyslipidemic state. Normal cholesterol level in their borderline high, even the triglyceride level above 200. All these can create abnormal scenario which can promote the vascular unhealthy condition, which can decrease the systemic supply, and ultimate can create systemic pathological changes, basically ischemic changes. Now I'm coming to the next point, glycemic index. Total the pattern of food, very common item, very bland, basically, this is called muri or rice products, and another is rasogulla. We know the total glycemic index in case of rice, and this is flattened rice, that's 95, and the sugar containing milk products in Rasgulla, they are 70. So this glycemic index, basically we have to know that how much quickly they are digested and increase the blood glucose level within 2 hours. And as a result of it, very quickly after intake of such type of foods, after intake very quickly they are converted to glucose component. And these glucose component when increase very rapidly, they can increase the total glucose tolerance level. And when cross the glucose tolerance level, the hyperglycemic state when level when touch the tolerance level, that excess glucose will leakage through the urine, and ultimately the state of diabetes mellitus. We know that diabetes mellitus, that there are two types. There are type 1, type 2. Type 1 due to the damage of beta cell, whether it may be some known cause, sometime unknown cause, whatever may be. And in case of type 2, their insulin deficiency is not the point. There other rather than insulin inactivity or insulin resistance, they are caused. As a result of it, the improper biological insulin or the insulin resistant state cannot help to entry of glucose within the cellular sector. That means the insulin signal at the tissue and capillary targeted cell of insulin, they are not functioning properly. So as a result of it, insulin are not properly helps to entry of glucose from blood plasma to tissue. And as a result of it, total tissue are crying for more and more glucose. But within the plasma there are huge amount of glucose increasing. A time will come when total the disruption of the glucose tolerance level and will cross the threshold, then they will pass through the urine. So as a good doctor, our advice to the patient must have that that have to HbA1c should normal, and that must be below 5.7%. But pre-diabetic state, the scenario may in between 5.2 to 6.4, and diabetic state which become more than 6.4%. As a doctor, we have to advise to the patient to not only the fasting blood sugar level, not for the pp blood sugar level, but advice for HbA1c study, which can help to assess the glucose level as a mean value in between 3 months. So that would be helpful for total disease status, how much progressing and how much going in rapid mode should be diagnosed properly by this study. And as a result of it, we can protect the systemic damage, vascular damage from the diabetic pathology, from the narrowing of the blood vessels, the tissue ischemia, the damage of the tissue, formation of the foot ulcer, diabetic gangrene. All these scenarios may be arrest within limit, within time, and just after proper diagnosis, just after proper advice of the total food intake, the specific type of diet chart must have advice, even the drug advice, which must be rigid to protect the complication of the disease. Now, I'm coming to the glycemic index of the different type of food components. Those are helpful for formation of the diet chart for the diabetic cases. This is very helpful, but there are so many items in this slide. Just takes more time. Now I'm changing to the next part. Now I'm coming to the another very important point. Another very important point. Those are triggering to the different systemic disease, the assigned as lifestyle changes. This is smoking. So smoking Smoking is very simple. Smoking, just one cigarette I smoke and release. Okay, all right. But this smoking is is very harmful to our healthy life. Ultimately, within the bronchial tree, we know that all bronchial tree, they are covered by inner lining. Their pattern of inner lining are ciliated columnar epithelium, and this ciliated columnar epithelium helps to protect the microparticles from air, which we are taking by inspiration. But in a smoker, during smoke, we basically inhale the carbon colloids. These carbon particles with smoke, during smoking, they are deposited within the base, within the ciliated columnar layers of the epithelium, and ultimately these microcarbon particles will create the acute and gradually the chronic inflammatory scenario within the bronchial mucosa, and these chronic inflammatory changes within the bronchial mucosa gradually that damage the ciliated epithelium and will form the chronic inflammatory changes known as COPD. This smoking is a component of the abnormal lifestyle disease, acting as a triggering factors. Those can create COPD, can create bronchial asthma, can create emphysematous changes of the lung. So not only not only the treatment, but as a good physician, we have advised to the patient those are susceptible to developing the disease as a lifestyle changes, to avoid smoking, to avoid such atmosphere the containing carbon particles or dust particles, even more allergens. Now I'm coming to the next part, that is bronchial asthma. We know that the scenario develop either from thickening of the inner mucosal lining of the bronchial lumen, the changes of the reed index by depositions and formation of the mast cells and another defensive cells. And another point is bronchospasm. Those can developed by the different mediators, suppose serotonin, prostaglandin, leukotriene, 5-HT, etc. And these antigen antibody reactions by allergic component, which we are inhale or ingested by food component, basically sensitive to bronchial muscles, and these smooth muscles become spasm and ultimately narrow the bronchial lumen, and this can establish that paroxysmal attack of dyspnea along with cough and expectoration. So so good physician must have to advise their patient to avoid the triggering factors to maintain healthy life rather than medicinal treatment. This is the prevention is more better than treatment. This is lifestyle disorders. All are developed by abnormal lifestyle. By simple advice, we must propagate ma- to to avoid such lifestyle. Otherwise, patient will suffer by this problem. Now I'm coming to the lung cancer. We know that this is the worst complication developed from smoking and other abnormalities. So this is the almost dead end problem. Now I'm coming to the another very important disease, that is gout, also as a component of the lifestyle changes. We know that the scenario developed by hyperuricemia, and this hyperuricemia, basically we intake the different types of protein component, and these protein component and followed by uric acid component. This uric acid total metabolism within our body maintained by purine cycle, and these purine cycle basically the total amount of body uric acid pool, basically one third from our dietetic entry and two third from the other metabolic purine sector, basically by the tissue nucleotides within this liver by xanthine oxidase catalyst যেটাকে আমরা UDPG, and ultimate by xanthine oxidase catalyst, and by the total convertage. Basically this uric acid and its non-toxic mode, they release from our body maximum through urine and one third through the stool. Abnormality is if after intake of this uric acid pool, either from urine, from diet, or from tissue damage, either properly not excreted through the urine or through stool, they become deposited within our body and particularly within our joint sector. We know the total joint areas, mainly the contributed by bones, cartilage, capsule, bursa, tendons, ligament, muscles, whatever may be. They, in fact, by increment of uric acid and their depositions of these MSU crystal, monosodium urate crystal, monohydrate crystal, they become deposited within the intrajoints area. And these needle-like crystal component, when deposited within this joint area, the internal joint structures become damaged and ultimate the joints swelling with very acute arthritis. And this is a very common lifestyle abnormality, lifestyle disease. If we avoid to take red meats or urine containing or the uric acid containing high protein diet, we easily can avoid this type of gout or other gouty arthritis. Also, we have to maintain the hepatic functions. We have to maintain properly the functions of kidney. Otherwise, these joint structures become deformed, and this is the very dangerous deformities we are observing in different joint structures in the lower extremity. The final point. Now, the similar, the deformities are present within the joints of upper extremity. All are developed from depositions of MSU crystal, monosodium urate monohydrate crystal, by the disease of uric acid. So, should avoid the food component which are containing excess protein, excess animal protein. These are the main abnormal triggering factors for developing of the gout, along with the distortion of the hepatic and renal functions. Now, another very important lifestyle disease, that is osteoarthritis. And these osteoarthritis basically form in weight bearing joints, in large joints. Basically, it may be knee, sometime ankle, hip. Or this scenario usually developed either from the malalignment of joint structures, sometimes the bone density become deformed, and these are formed basically by cytokine release from the adipose tissue. Sometimes the genomic mutation also can create some cause for formation of these osteoarthritis, and the congenital abnormality, and also the exposures of some risk factors like farmers, like miners, like athletes, excessive weight gain. These all can create the abnormal changes of intra-articular areas, and which form the microfracture within the articulating surface of bones. And these microfracture gradually will expand its area, and the total wound will form in between joint structures within the articulating surface of the joints, along with cartilage and ligaments. And in case of osteoarthritis, this is the exact pathology which are the main presentation in acute osteoarthritic cases. As a good doctor, we must have avoid a patient to do not intake excess calorie which can promote the weight gain. We may avoid the such type of joint disease by simply weight lose and abnormal abuse the joints activity, faulty technique, abnormal flexion attitude of sitting postures, all can create this injury within the large joint structures. So along with drug, along with management, we should avoid the basic technique of the lifestyle. By easily we can avoid such type of joint disease. Now another very problem, that is ankylosing spondylosis we face. And basically, there are large number of young peoples come to us that, sir, I am suffering from neck stiffness, spinal pain, and abnormal use of laptops, abnormal use of tabs, abnormal use of mobiles, whatever may be. Otherwise we will suffer some problem. And ultimately, by this ankylosing spondylosis, the normal vertebral space become reduced, and ultimate reduction, by reduction of the intervertebral space, they become fixation. And the disc space when reduced and their fixation, ultimately the total movement and their bending postures become painful. And patient ultimate will come to us with different types of deformities, along with the bulging of intervertebral disc, along with fixation of vertebral bodies. All these are painful state. So we should advise the patient that maintain basic posture of body, yeah, use of laptops, tabs, mobile, not all times of our living, and basic exercise will be helpful to avoid such cases. Now, the normal and abnormal total bending posture, sometimes scoliosis, sometimes lordosis, sometimes kyphosis. These scenario are the ultimatum of these joints abnormality, basically develop from lifestyle abnormality. Now I am coming to the next. What is the target? As a good doctor, we must have to know that what disease is present within the patient. That means knowledge of the disease. So from symptoms, from sign, and from clinical examination procedures, we have to reach the exact diagnosis. If any investigation, it may be helpful to reach the final diagnosis. So after final diagnosis of the disease, it is clear that which symptoms in the patient are disease symptoms, which are common symptoms, which are uncommon symptoms, which are peculiar symptoms, which symptoms are higher value, which symptoms are lower value. So, total symptoms after assessment of the same symptoms, uh, we must have to evaluate of the symptoms, and after proper evaluation and analysis of the symptoms, the totality will help you to select the exact similimum along with removal of the triggering factors, along with advise the proper diet, along with advise the non-medicinal management. We must have to prescribe the most similimum drug, which will helps to reach the exact homeopathic cure. That means knowledge of the disease, knowledge of the repertory, evaluation of the symptoms, knowledge of the drugs, and total combined as a whole, you will prescribe the similimum along with the removal of the causes, removal of the triggering factors, advise the proper diet, other non-medicinal management. Ultimate, we will get the total cure along with the limitation of complications. Now I'm coming to the next part. The In our clinic, after total detection of the cases, the knowledge, after application of knowledge of disease, after application of knowledge of repertorization, the total drug evolution of the symptoms, ultimately we get the similimum, and after prescribe the total medicine as a whole, knowledge of the disease, knowledge of the materia medica, knowledge of the repertory, and by knowledge of the organono-medicine, the total susceptibility, assessment of the constitution, assessment of the miasm, we select the similimum. In case of practice of medicine, along with symptoms, the clinical examination procedures must have to perform properly. Otherwise, we have to advise for different lab investigation, which is not possible in case of homeopathic treatment. Patient will shift to the specialist. So, as a good physician, as a good homeopathic physician, we must have to perform the total examination procedures exact by using the clinical medicine properly. By the help of organono-medicine and repertory, we have to evaluate the symptoms, which is essential in this case, which is more valuable, which is less valuable, which is common symptoms, which is uncommon. From the knowledge of disease, we have to select, and ultimate, the total case will come to the optimal cure. Now, suppose a patient, from practice of medicine, we have to know that which symptoms is common, which one is uncommon, which one is very rare, which will support you to take the similimum. Suppose a patient come to us, the vomiting without nausea is a very common symptoms of the brain tumor. So increase due to the increased intracranial pressure. The same symptoms we get in materia medica in case of ferramate. But the except brain tumor, we increase intracranial pressure, it become a strong physical general, as also peculiar symptoms of ferramate. That means ferramate, we will get the exact improvement of this case other than brain tumor, because in case of brain tumor, the symptoms is a common symptoms. This is not uncommon. So value of symptoms, the vomiting with the nausea, the ferramate will prescribe, but not we get the optimal cure. So this will help only the detection of the underlying pathology by the knowledge of medicine. Similarly, suppose a patient come to us, the convulsion by dazzling of light or running water, the very symptoms of rabies, and same symptoms present in materia medica in lysine. But in case of lysine, in case of rabies, if we prescribe lysine, will not cure. But patient when suffering from same symptomology other than rabies, the lysine will be the drug. That means same these symptoms in case of rabies is a common problem. So lysine is not the indicating drug. We have to know by knowledge of practice of medicine, say which symptoms is curable, which is not, which is common, which is uncommon, same as in natrum carp, same symptom as natrum carp. Another one, walking on an uneven ground that aggravate the pain. It is very common symptoms of slip disc. The symptoms present also in the cornea maculatum. But a patient when is presenting the symptoms in case of slip disc, cornea maculatum will not give the optimal cure because the symptoms is due to slip disc is a common symptoms, but cornea maculatum will not exactly cure the case. But patient when presenting with the symptoms without slip disc, conium is the drug. So we have to identify the same in case of graphitis, in case of cupramate, whatever may be. From the knowledge of disease, we have to identify the site of pathological changes, the extension of the pathology, the pattern of tissue in which the pathological process is going on, the extent of the disease state, ultimate, which is acute condition, which is in severe chronic condition, which is in the functional state, and as a result of it, the assessment of the drug, the similimum, along with proper potency, otherwise, otherwise, the exact potency selection, exact disease selection, without evaluation of the symptoms, without evaluation of the symptoms from common, uncommon, peculiar, without the knowledge of medicine, after application of this medicinal knowledge, the knowledge of mathematica, repertory, organomedicine, the as a whole will help you to reach the optimal cure of the case. So, what to do in this context? We should avoid alcohol, avoid smoking, avoid sugar and added sugar in our food component, avoid double or triple fried food, which I explain in detail, avoid ghee, butter, and junk foods, avoid food or high glycemic food of high glycemic index, avoid red meat, active physical, promote active physical work, and the mental satisfaction and peace, which can promote the most healthy and peaceful life. Thank you. Thank you.
Thank you so much, sir, for giving an amazing webinar, and it will helpful for all students, I hope. And thank you again for giving your precious time in this webinar.
Thank you. Thank you. I think again I will meet in anywhere. Okay?
Okay, sir. Okay.
Okay. Bye.
Bye, sir. Thank you again, sir. कल के वेबिनार के बारे में मैं बताना चाहूँगा। हमारा जो कल का वेबिनार है वो ब्लूप्रिंट ऑफ सुपर स्पेशलिटी इमरजेंसी मेडिसिन एंड सर्जरी विद रिलेशन टू ऑर्गेनन ऑफ मेडिसिन पे है, जिसे ऑर्गेनन ऑफ मेडिसिन के एफोरिज्म और फुटनोट के साथ इंटरकनेक्ट करके आपको रेफरेंस के साथ दिखाया जाएगा। तो कल ज्वाइन हो जाइएगा टाइम पे 8 बजे। और हम साथ ही साथ इस वेबिनार के एंड होने के बाद इस मंथ से स्टार्ट कर रहे हैं ऑर्गेनन ऑफ मेडिसिन और एलेंस की नोट की मास्टर क्लास। तो उसके बारे में एक छोटा सा इंट्रो आपको देना चाहूँगा। ये मास्टर क्लास हम लोग स्टार्ट कर रहे हैं इस मंथ से, नेक्स्ट वीक से, जो कि ऑर्गेनन ऑफ मेडिसिन और एलेंस की नोट के ऊपर है। तो आप लोग कल और परसों के वेबिनार में जरूर ज्वाइन होइएगा, क्योंकि कल ऑर्गेनन ऑफ मेडिसिन के मास्टर क्लास के बारे में एंड में बताया जाएगा, क्योंकि कल ऑर्गेनन ऑफ मेडिसिन से रिलेटेड ही वेबिनार होने वाला है, और परसों एलेंस की नोट से रिलेटेड। थैंक यू।